Hi, I'm Robin Shudo, founder of Empower Total Health. And the topic for this week's weekly update is the futility of risk factor management, cholesterol-lowering drugs that cause diabetes. A meta-analysis of observational studies published in the journal Nutrition, Metabolism and Cardiovascular Diseases has found that cholesterol-lowering statin drugs raise the risk of developing type 2 diabetes by 44%. Statins remain the most prescribed drugs in Australia, with atorvastatin, which is sold as Lipitor, and rosuvastatin, which is Crestor, leading the top 10 drugs by prescription count in 2015. There were 10,557,512 prescriptions written for Lipitor and 9,432,332 prescriptions written for Crestor in 2015. Different types of statin drugs carry different risks of developing diabetes. Users of rosuvastatin, that's the Crestor, had a 61% higher risk of developing diabetes than non-statin users, while for atorvastatin users, that's the Lipitor users, the risk was 49% higher. Simvastatin, which is sold as Zocor, was the least diabetogenic or diabetes-inducing. It conferred a 38% higher risk of developing diabetes. Randomized clinical trials of statin drugs, these are trials in which half the participants are given a statin drug and the other half are given either a placebo or sometimes a different drug, have come up with much lower estimates of the increased risk of diabetes that's associated with these drugs, somewhere in the order of 12%. But the authors of this meta-analysis point out that randomized controlled trials are actually not set up to measure diabetes risk, and so they tend to underestimate it. Observational studies, on the other hand, have much higher numbers of participants. The participants are far more typical of the types of patients who are actually prescribed the drug once it's released onto the market. And this is quite unlike participants in randomized controlled trials. In randomized controlled trials, they recruit subjects who are at the lowest risk of suffering adverse reactions because, of course, that makes the drug look far better, so it can actually get approved and then be released onto the market. Once it's on the market, then people with much more complex health pictures end up taking the drug. And these people from the get-go have a higher risk of adverse events. And of course, observational trials have much longer follow-up periods, which makes them far better suited to detecting adverse events such as development of diabetes. In all, 20 observational studies were included in this meta-analysis, with a follow-up duration ranging from 2 years to 20 years. Defenders of statins have suggested that having a high cholesterol level in the first place puts people at increased risk of both cardiovascular disease and diabetes, and that the sickest patients are most likely to prescribe statins, so they may be at higher risk of developing diabetes whether they take the drug or not. But the authors of this study pointed out that many of the studies that they analysed controlled for these potential confounding factors. But for example, by only enrolling participants who had high cholesterol levels and comparing diabetes risk in those who took statins to those who didn't. Also, there was what's called a continuous relationship between statin compliance and diabetes risk. In other words, the better that participants were at taking their drug regularly, the better patients they were, the higher their risk of developing diabetes. So there was a dose-response relationship. It's not entirely clear why statins raise the risk of developing diabetes, but there are several lines of inquiry. Firstly, in randomized controlled trials of statins, their use is associated with weight gain, which is in itself a risk factor for developing diabetes. Secondly, lowering LDL cholesterol in itself may raise the risk of diabetes. Thirdly, laboratory studies have shown that statin drugs damage the beta cells in the pancreas that produce insulin. Fourthly, statins interfere with the activity of insulin in multiple ways, leading to insulin resistance, which is the state that characterizes type 2 diabetes. And fifthly, interfering with cholesterol production means that statins also inhibit the synthesis of several other biological compounds that are involved in glucose metabolism. The great irony in this whole sorry tale, of course, is that statin drugs are prescribed to lower cholesterol and therefore reduce the risk of cardiovascular disease, such as heart attacks and strokes. But having diabetes more than doubles the risk of having a heart attack overall, and more than quadruples it in women. For Asians and South Asians who become diabetic, the increased risk of having a heart attack is even more dramatic than for people of European descent. If you were looking for a perfect illustration of the sheer folly of the current medical approach of risk factor management, this is it. Instead of educating patients about the causes of their high cholesterol level, which is their poor dietary habits and sedentary lifestyle in the vast majority of cases, and coaching them to make healthier choices, doctors write a prescription for a drug that raises the risk of developing a serious chronic disease that in turn raises the risk of developing cardiovascular disease, not to mention blindness, kidney failure, sexual dysfunction, limb amputation, and a host of other nasty complications. In the words of the authors of this meta-analysis, we should consider that the diabetic patient is not only characterized by an increased cardiovascular risk, but also by other complications, the need for drugs, and worse quality of life. These aspects are difficult to quantify, but might result in a clinical and economic impact. You think? In stark contrast, when people with a high cholesterol level adopt an oil-free, whole food plant-based diet and increase their activity level, their risk of diabetes actually decreases, along with their risk of cardiovascular disease, high blood pressure, obesity, and several types of cancer. It takes enormous technical cleverness to identify the enzymes called HMG-CoA reductase, which is required for our bodies to make their own cholesterol. And it takes enormous cleverness to develop a drug that targets that enzyme in order to shut off cholesterol production and lower our serum cholesterol level. Unfortunately, cleverness is not wisdom. It isn't wise to write people a permission slip to continue indulging in their bad habits, which is effectively what writing a prescription for a statin drug equates to. Instead, the entire practice of medicine needs to be overhauled so that people are told the truth about the connection between their daily habits of living and their health outcomes, and provided with assistance to change those habits. That's lifestyle medicine. Health comes from healthful living. It doesn't come out of a bottle of pills. I do hope you enjoyed this topic. Please like and share the video on your usual social media channels, and I will catch up with you for next week's weekly update.